Everyone. Hope everyone is doing great. This is Akhil Pratyush, and this evening we are here to explain our final project of INFO-H517 data visualization and analysis. For our final project, we have chosen a healthcare dataset which explains how healthcare system across the world has been developing and how the indicators are doing so far. This data set we have sourced it from OECD, and we had a lot of information in the data set, and then we merged the data set so that we can get a meaningful insights out of the data set. So we decided to divide the data set into three categories. Each category giving us a different insight and a meaningful insight. The first category would be how people's spending on healthcare is evolving over a period of time. And the second one is, okay, you are spending money. What are you expecting? You are expecting quality health. So the second category would be how the quality of healthcare in the world has been evolving. And the third thing is, okay, you are spending money and you are getting good quality healthcare. Okay, so what about the quality of life you're leading? So, and the third category would be how the quality of life is improving. So, based on that, we divided our dashboard into three parts. If you can see, so this part would show you, how the quality of healthcare has been improving, whereas this part would show you, how the quality of life has been improving along with this average life expectancy map as well. Okay, uh, for excuse me, for average life expectancy, we have taken a map, which explains how the life expectancy has been improving across the world. If you can see, it's a heat map as well. Just if you click on one country, it would show you how the life expectancy is. And apart from that, this life expectancy map acts as a filter as well. If you click on a country, it would automatically apply the filter to the entire dashboard so that you can see the information across all the views. And we have also added a lot of information which would be explained by my teammates from now on. I'm handing it over to Babu right now.
Sorry. Thank you, Akhil. So, before going to my discussion, I will explain what are my choices for representing the data. So, to represent per capita out of pocket spending, we have chosen area chart. To represent per capita pharmacy spending, we have chosen line chart, and for child vaccination rate, also we have chosen line chart. So, we are using different color encodings to differentiate countries, and we added tooltips for each and every chart so that the data will be clearly visible. And as you can see the trend, the per capita out of pocket spending is steadily increasing till 2019, and there is a drop in spending. The main reason for that is in 2019 we have COVID, and due to that government started providing more relief funds so that the out of spending from pocket got reduced. So this is the reason we identified for this downtrend. If you observe per capita pharmacy spending for all countries, there is an increase in it, and the same goes with child vaccination rate. So if you observe for this particular country, in the beginning around 2000 it's 58%, but later it got increased to almost 86%. And as Akhil said before, you can use this map as a filter. So let's look at US. Yeah. So if you observe, for US there is a steady increase in per capita outspending like other countries, and there is also steady increase in per capita pharmacy spending, and the child vaccination rate is almost steady during the entire period. So that's all about these three charts. Now I'm handing it over to Rahul.
Thank you, Mani. And in this dashboard, we have the histogram which represents the hospital beds availability along with the country name. So here on the x-axis you can see the name of the countries, and the y-axis we have the number of beds present in the country. So this we can, if you can select the country on the map. For example, I'm going with Japan. And so when I click on the Japan, so we have dashboard representing data of the country. So here you can see the country Japan, which has the number of beds availability in Japan per 100,000 people is 14.58. And similarly, you can select some other countries like now I went for Canada. Here you can see the number of hospital beds availability per 1,000 people is 3.6 in Canada. And here we also have a filter to select the year which you want to analyze the data about. For example, here now we are showing for the year 2001, and if I click here, so now this dashboard gonna show me the data of 2002. And coming to the next one, here this histogram will depict the data about number of doctors and nurses. So the black one here represents the number of doctors available present in Canada. You can when you hover on it, you can see the figures here. Similarly, we can see the number of nurses available in Canada. So it's for Canada it is 169.4 per 1,000 people. And we also have a filter here for doctor and nurses. So if you click on that button, it's gonna give you data about the 2002 or whatever year you want to see. And we also has a stacked bar chart here, which gonna say the information about hospital say. So all these represent the number of hospital stays in a particular country in a year. For example, if I click here, if this gonna show you in 2003 in Japan, we have average hospital stay is for 20.70 days. So and now I'm hand over to Amin.
Thank you, Rahul. So I will be talking about infant mortality per 1,000 births. As you know, infant mortality has plagued the developing nations in the early 20th century. This is due to the poor care provided to the mother during childbirth. But as the health care provided to mothers has developed, the infant mortality rate has also came down. So we can take the example of India, and you can see that the infant mortality rate per 1,000 has dropped significantly, and that's like a huge improvement. And we can see, for example, USA, and we can see that there is like a steady decrease in infant mortality. So we can also see the number of cancer deaths per 100,000 people, and cancer is like a burning issue across the globe. So the advent of modern medicinal technique and method has reduced the number of cancer deaths. So when we see in the US here, we can see that the cancer deaths are year by year they are decreasing, which is a good sign. So we can also see the number of suicides per 100,000 people. In this area graph, we can see that the number of suicides, unfortunately, is increasing, which is like not very good. And this is an indication that the psychological mindfulness of people, and they are not feeling very good, and maybe because of stress or anxiety, which is not very good indication. For any more informations, we also have those links for final report. If you click here, you can see that we have a detailed analysis that shows all the information we are talking about. So we thank you very much, and that's it.
Thank you very much, Amin. This is really insightful. This data we have here has given us a lot of insights. You know how the healthcare system across the world has been evolving so far. As we can see, we are spending a lot of money, but are we getting the worth? Yes, I can say yes. We are having quality healthcare. The number of beds are increasing. The number of doctors and nurses are increasing gradually. And the hospital stay, if you can see, is decreasing, which is also a good indicator. That means people are spending less time in hospitals. which is an indication that quality healthcare is being provided. Apart from that, infant mortality, as my friend said, is going down. The cancer deaths are going down, and the suicides, they should be looked into a bit. And yes, we also added estimated values which can project the values for future, which can be useful for future references. That's it. That's about our presentation. Hope you all liked it, and you can always visit this. This is a public dashboard. You can visit this dashboard and get more insights from the project report, and you can also click the links as my teammate said. Thank you very much, guys, for being here and being a part of this team, and have a great day ahead. Peace. Bye bye.